हम डिस्कशन शुरू करते हैं आज का हमारे एक्सपर्ट्स के साथ। सर,
Normally, a normal person while walking, he bears weight at one part of the body that is known as foot. That is also the plantar surface of the foot where the total weight of the body is borne by the patient. And no other part is such means the solid base, so where you can bear the weight. All other parts are very sensitive and you are unable to bear the weight there, and it is not possible to make the patient to bear the weight in other parts except that actually. Then we have to select some areas where you can make the patient to bear the weight. So where the weight is borne by the end of the stump, so that is known as a weight bearing prosthesis. And where the patient is unable to bear the weight at the end of the stump, so that is known as non-weight bearing. Means the stumps are divided into two parts. One is weight bearing stump, other one is non-weight bearing stump. So there are different levels are there in the body. So for example, if the patient is unable to walk, if the patient is a crippled one and he wants to crawl, so that time he is bearing the weight on the knees and the hands actually. So that is he is walking with 4-point gait actually.
right.
So that is a crawling point. So there also the palmar surface of the hands are solid enough to bear a
With
weight,
the weight of the body.
and the knee part is also such a
Strong
part,
enough.
also the patient can bear the weight. But other parts he can't take weight of the patient. So total number means the weight bearing point of view, if you see, the 100% weight of the body is borne by the foot itself. In the foot it is divided into again two different groups are there. 40% of the weight is borne by the heel itself, and 20% is borne by the first metatarsal head, and 10 each by the all other toes actually, metatarsal heads of the toes. So this is total distribution of the weight bearing actually. So and weight bearing and non weight bearing, the difference means the sensitive part, where the sensitive part is there, where there you can't bear the weight, and non sensitive areas you have to select it. So accordingly, while doing the amputation also, the surgeon will take care of that actually. So if he wants to make the patient work with end weight bearing, then he will go to that particular level actually. And suppose if you want to save the maximum length of the limb, then the end weight point is not possible. Then we have to select the bearing of the weight is separately. So this is actually the weight bearing and non-weight bearing stumps and the limbs.
And like Mr. Manohar has mentioned that we are talking about the prosthetics only. Prosthetic means when we require an artificial limb. So artificial limb means if there is an amputation. So if the end weight bearing is that the foot is the basically in the normal position, the foot is a weight bearing area of our body. But once it is amputated, then we have to look for some other weight bearing areas in the body itself. Because for ambulation, everyone that we need to put a weight on alternative legs, once on left, once on the right side while walking itself. So we have to find out the weight bearing area in the amputated part. So if there is an amputation below the knee, above the knee, any amputation, because this is by accident or by any other disease, it is not by choice. So this amputation is only by an accident. So in that area means if foot is lost, then we have to find out a weight bearing area, because foot has been lost, which is the main component of our body that which bears the body weight. तो हमें इसके लिए एक्सप्लोर करना होता है हमारी बॉडी के अंदर ही कहाँ पे. जैसे फॉर एग्जांपल मैं आपको ये बताऊंगा, जैसे अभी हम लोग बैठे हैं, चेयर पे बैठे हुए हैं, तो हमारा वेट पैर पे नहीं है, हमारा वेट सीट पे है. सो वी आर सिटिंग ऑन आवर सीट. सो दैट इज आवर ischial tuberosity विच इज बियरिंग द बॉडी वेट, जो हमारे शरीर का एक हिस्सा है जो इस तरह से हमारा एंड वेट में उसके ऊपर वेट आ रहा है करके. सो दैट इज द इन केस ऑफ अबव नी एम्पुटेशन दैट वी सेलेक्ट दिस ischial tuberosity जहाँ पे हम 2 घंटे बैठते हैं, 3 घंटे बैठ सकते हैं, पिक्चर देखने जाते हैं 3 घंटे बैठे होते हैं यहाँ पे. तो continuously you can sit for long time. It means you can bear a weight on that particular part of the body where we can transfer the body weight. While walking also we use that. This is the technology which we use from it. So if there is any amputation which is below the knee, so at the time you can see kneeling is possible, that we do stand on our knees, bending our knees on the ground, or children, they used to play even on their knees. So if knee is bent and there is a tendon at the patellar tendon, there is a patellar tendon that which bears the body weight.
Okay.
So that is the part where we select that area, that is the weight bearing area. So this is the selection of the weight bearing area. कहाँ पे किस तरह का वेट, कितना वेट ले सकते हैं बॉडी का, बिकॉज वी हैव टू ट्रांसफर द बॉडी वेट. वेट तो हमें ट्रांसफर करना ही है चलने के लिए. वी नीड ए स्टेप बाय स्टेप चलना पड़ेगा. तो एक नॉर्मल साइड है, इवन समटाइम्स देयर इज ए एम्पुटेशन ऑन बोथ द साइड्स, देन वी हैव टू सेलेक्ट फॉर द both the sides itself. So weight bearing means we have to transfer the weight. So this is the topic that which we will be talking today, that where to put a weight, and we have got two options. One is the end weight bearing, one is the rest of the part non end weight bearing prosthesis. So these are the two different type of the prosthesis which are being fitted at a different level of amputations. So we can have see, if there is a partial foot amputation, means we have got half of the foot or part of the foot is with the patient. So that part will be sufficient to bear the body weight. Only the thing we need to do the filler, and the patient will be losing some of the movements, not much, very few. So it doesn't make any difference to the viewer that if the patient is having an artificial leg, because if there is any partial foot amputation is there. So in that case it's very clear that patient can be very freely walk similarly as a normal. Only the thing, few limitations will be with the patient itself. No one can judge that it has got any problem, but there will be some limitations if forefoot is not there. So similarly, that is the partial foot amputation. If there is a foot amputation, then we can use it. We can go for that. So after that, there is a level of amputation. If we go a little bit higher, then that is the through ankle amputation. So foot is been lost. Both the long bones, our tibia and fibula, are saved, but at the ankle level there is an amputation. So in that case, sometimes surgeons now they are very well aware of that end weight bearing is better than the other part of the weight bearing area. Why it is so? It is a very simple thing, that end weight bearing is a broader area. Means weight bearing area is broader, like Manoj sir has said ki 40% is 60% is by the heel and 40% that is by the great toes also. But see, if there is a weight bearing area is broader, then the weight is being divided on a wider area. That gives more comfort. I'll give you one example. If we are lifting in a bucket full of water, if we are lifting with all 4 fingers is more comfortable. If we lift with 1 finger, it's difficult. It means the area, the lifting area, the weight bearing area is broader in case of 4 fingers, right. And if it is 1 finger, it's difficult. So if there's a weight bearing area is broader, it means the comfort is much more. It's easy to bear the weight on that itself. So that's why if it is end weight bearing, means broader area is there. So weight bearing is more comfortable than the comparative to the other part of the body part, if we consider that for the weight bearing. So this is the mode. Another thing is, because end weight bearing has got some bulbous point or some wider area, as I have mentioned, so there is a suspension, self suspension is possible in the weight bearing area, in the end weight bearing, because we can just cover it with the flap itself. We can cover the socket, and then straight away, then we don't need any suspension for that. So that is the another advantage for this weight bearing area that we are talking today. The prosthesis which is being fitted with the end weight bearing prosthesis is much more comfortable. But only the thing that if the level of amputation goes high, right from foot to if we go to the hip, it means then we are losing more joints.
Yeah, right.
If foot is lost at the ankle level, means ankle movement has been lost. If there's a below knee, then ankle movement is lost. Only the knee movement is then normally the naturally movement is there. But if someone loses the leg above the knee, it means losing the ankle as well as the knee also.
part, right.
So if there is an amputation above the knee, then hip disarticulation means we are losing all three joints. Ankle is lost, knee is lost, and the hip is also lost. So all the three joints has been lost. So as we go higher to the amputation, then complications are much more. So level of amputation is lower, then complications are less.
Okay.
So ये सब चीजें then we have it today that topic with the hand weight bearing के साथ में, then this is, so there are different level of amputations, like partial foot amputation as we have discussed. The partial foot means any part, either forefoot or the midfoot, the foot is lost. So that is the partial foot amputation. In that case means only the filler is to be given and very few things has to be done, and easily patient can walk with almost the most of the comfort. And then the level of amputation is then SAMS, that is the through ankle, which is known as the SAMS amputation because it was operated in such a way by the Dr. SAMS. I believe that, I think Manoj sir will find that Dr. Sam was there, that who amputated
That
this.
is actually inventor's name, so they have given the
Inventor's
name
name
of the
was given.
amputation.
Okay, so he was
And
doctor.
Sam's
as well.
amputation.
Yes, Sam's amputation was given. So that was the, in that case what he did at the level of amputation, if at the ankle level, then he saved the palmar part of the plantar part of the foot, जो नीचे का पोर्शन था, जो स्ट्रॉन्ग मसल्स है जिसके अंदर जो हमारी बॉडी को पूरा वेट बियर कर सकते हैं, उसको सेव करके उन्होंने नीचे से फ्लैप करके उसको स्टिच कर दिया नीचे बेस पे डिस्टल एंड के ऊपर, सो दैट की वेट बेयरिंग एरिया शुड बी स्ट्रॉन्ग एनफ टू बियर द बॉडी वेट. तो ये टेक्निक उन्होंने डेवलप करी थी. बट इसके साथ में फिर थोड़ी एक कॉम्प्लिकेशन आया, क्योंकि फुट तो फिक्स करना ही है नीचे, उसके नीचे, बिकॉज ओनली द एंकल अप टू एंकल इज लॉस्ट, मीन्स फुट इज लॉस्ट, ऑल बोन्स ऑफ द फुट एंड एवरीथिंग दैट लेवल. So at the ankle level and the foot, there is a hardly gap of 3 to 4 inches.
Okay.
That in our foot, in our body itself, depending on the height of the individual. So in that case, there was a problem that how to fit a prosthetic foot. So prosthetic foot actually earlier days there were a bolt and nut bolt and hinge at the ankle level to fit a prosthetic foot. But in this case there was a only say 3 inches gap under the ankle itself to just to fit a foot itself. So at that time there was a foot was developed which is called sach foot, solid ankle cushion heel. Sach foot was developed. So that was introduced at that time because they wanted to accommodate the SAMS amputation itself. So in that case we need only 3 inches gap that we need for the sach foot takes 3 inches. And it can be fitted to the SAMS first.
And then the person will be more.
Person is more comfortable and it's more suitable to that.
Okay.
Latest development in the same level is also again now you will get molded rubber foot.
Okay.
So the patient can walk with that even barefoot walking without wearing a shoe, normal shoes. The patient can go for.
Okay, so
walk
that
without
artificial foot
artificial
is
foot,
no.
Yeah, that
the
is the
shape
foot.
of the normal foot.
Okay.
Like
So the
Jaipur
base
foot,
is
if you have
already
heard
there.
about the Jaipur foot, Jaipur foot is a
that
totally
is-
rubber foot, rubberized foot.
That is one more
So
advantage.
wood is not the only material
yeah.
that
In the
is
beginning,
used.
actually, that was the wooden foot,
Okay.
and that was also known as conventional foot. The problem to attach it is we need a nut bolt or screw system, something we have to attach. So that much margin is not available in SAMS amputation. So then the sach foot is invented, and then in the sach foot what happened means the base they can make a little hole and they can insert the socket what we made for the upper part of the stump actually. So that is fixed. Then the molded rubber foot is invented. That is cosmetically more acceptable, and you can also walk without a footwear. So that is advantage in that actually. There is one more actual amputation between the partial foot amputation and the SAMS amputation. It was invented in some place that was known as pyrograph amputation. Pyrograph amputation is what happened. See, once the amputation is done through ankle, so the patient is getting shortening of 3 to 4 inches. In pyrograph amputation, what they have done, the talus bone of the foot, they preserve it, talus and calcaneal, and they will fuse it to the ankle level, and the heel flap that remaining, that skin if it is available, they will fix it at the end of the stump. So then what happens, the shape of the stump is same like Sam's amputation only, but only the shortening is not there now.
Okay.
The 3 to 4 inch shortening is
That was earlier with the Sam's
compared that.
amputation.
So
Yeah.
this design actually this is designed mainly for rural area
Areas.
patients where the patient wants to walk a barefoot walking without wearing any prosthesis, without any wearing any compensation. So they can go directly to the field, they can work in the field. So only thing, the broad base is not there, the base is reduced, but still the patient is able to bear the
It
weight.
works
on
like
it.
a pylon.
Okay.
It's like that. So, on prosthetic point of view, if you see the disadvantage here, you can't fit a normal prosthesis to that, because the prosthesis where you want to fit, you need again 3 to 4 inches margin you need if you want to provide an artificial foot. So in this you can't provide an artificial foot directly because it is already compensated the length. So in this again you have to go for a shoe with filler type again. In a normal shoe, the remaining length of the foot we have to increase it artificially, and that will remain in the shoe itself, and the patient can't walk without a footwear.
Okay.
So that is one more design. So it means if one advantage you are getting out of the amputation level, if
There
then
lies a
there is a
disadvantage.
disadvantage in prosthetic fitting also. So these are the differences you will get actually. That is also end weight bearing stump, the paragraph amputation. SAMS is also end weight bearing. In SAMS again there are two types again. There is one end weight bearing stump, one is non end weight bearing stump. Both are there. Non end weight bearing means if the level of the amputation is through malleolus. After that, the heel flap, the skin of the heel part, which is thicker one, that is attached at the end of the stump by the surgeon to make the patient to bear the weight at the end of the stump. So that is very useful. If it is like that, then you can make the patient directly at the end of the stump. You can make a prosthesis like that up to mid calf length, then you can fit a prosthesis. And where the heel flap is not there, the foot is completely crushed during accident, or it may be burn cases, it may be any case, or it may be any disease. Due to disease the skin is totally spoiled. So in those cases that heel part is not available, then the patient is not able to bear the weight at the end of the stump. Then that is non end weight bearing, means then you have to go for the weight bearing point, you have to select other part. So then that we have to go up to the knee level. So that is known as patellar tendon is there below the knee, so where the patient can bear the weight. So you have to go to the upper level. So the design of the prosthesis of that level is different, and design of the prosthesis, the end weight bearing, that is again a different.
So these all were the foot
Yes.
amputations.
So
that
this
we were
is
talking about.
the design and the selection. This is everything is done by an expert prosthetist who will evaluate the patient, who will select the material, who will fit a prosthesis, and he will make the patient walk with a comfortable prosthesis. It's an art of a design.
Okay. So the size of
scale.
that artificial limb always vary person to
That is
person.
individual.
That is
Yeah.
Size is in, we have to match with the other
So,
side itself.
You can't keep any ready-made prosthesis like that.
So you
Only
have
the
to
foot pieces,
specially
only the foot
design for
pieces,
that.
only the foot pieces are available in
Different
different
sizes,
sizes.
normally like a shoe available in the market. You can also go for foot pieces,
Foot
different
pieces
types
in
of foot
different
pieces, different size of foot pieces. That you can keep it ready-made.
Okay.
It's like that.
But rest of the part that we have to make it as per the size of the individual patient itself.
Okay.
That is yes.
Alright, so that was the ankle amputation that we were talking about.
Yes.
So what are the other amputations? Sir?
So other is that if we go a little bit higher, then it is below the knee, in between ankle and the knee.
Okay.
So if it is a long stump, then we can go for a regular prosthesis, that is the PTB prosthesis or the non-end weight bearing prosthesis, as we have discussed in our previous programs. Whereas today we are talking about the end weight bearing. So what we'll talk about that if there is an amputation below the knee and it is very short, it's just below the knee.
Okay.
It's a very short below knee amputation. So in that case, again, see, we don't get the proper patellar tendon to bear the weight itself. So in that case, if we don't get the proper area for the weight bearing, then what do we want to do? We can flex the knee, whatever the remaining knee is there, remaining muscles are there, we can flex it and it becomes a bent knee. It becomes like a kneeling like type.
Okay.
So as we kneel on the ground, so we can bend the knee and then we can make the prosthesis. So
Alright.
considering that below knee as a and weight bearing prosthesis by giving and just bending the knee and treating as a say knee disarticulation, we can say.
So, but what's the advantage of bending the knee here?
It's that because one thing that I told you, the problem that if there is a very short below knee,
Yeah.
because in below the knee we have got more bony areas much more than the muscles.
Right.
Muscles are less, whereas in above knee we have got a lot of muscles and very less muscles over there.
Okay.
So the bony prominency is there. We can't put a weight on the bony prominency. Body weight is not possible.
Okay.
We need some muscles. So once only the tendon that we have got, patellar tendon, which is strong enough to bear the body weight. As I mentioned in the early type that kneeling is possible. We can do the kneeling. We can stand on the knees, bending the knee. We can stand on the ground for a long time also. So that is the point where we can get the body weight. So we need to transfer the body weight from any part of the component that we want to fit a component with the prosthesis, so that the body weight should be there. Even though we provide the cushioning over there, we can give a silicone cushioning, we can give a rubber cushioning. There are plenty of cushions are there, but even then we need some. We have to prevent the bony prominences.
Okay.
Wherever the bone is there, we have to protect them from the pressure area. We can't put a pressure on the bony prominences. It's very difficult. So similarly, that's why we have to bend the knee and keep it as a bending knee, and it can rest on it. I have seen some of the places in the villages, like villagers, they don't have an idea which is end weight bearing, because they are irritated about it. Prosthetic means they don't know anything. Once they have been amputated because of any accident or maybe because of any disease, if they have lost any leg below the knee, so what they do, they prefer to bend the knee and put it on a crutch,
Right.
and they walk with this. They don't have an idea that they are using the end weight bearing, but only the thing that they feel more comfortable in that,
Yes.
without knowing.
There are so many adaptations actually patient himself can do.
Okay.
So instead of before coming to a
Prosthetics.
Prosthetics.
Rural area, there are
in rural areas.
adaptations are there.
So some mode of ambulation they need. So some mode of ambulance means walking with any type of attachment. They will take a stake. They will
They do
take
the
a bamboo
modification in
stake,
their
they will take
crutches only.
Crutches.
At the
They
knee
will
level,
make
they
a
put a
platform
plank
and
and
bend it.
make the resting point for the bend knee.
Oh yeah, I've seen that.
They bend it. They just keep a danda or any stick over there on the knee
And
level.
the
At the
wooden
knee
plank
level,
is there.
wooden plank is
Yeah.
there. They bend the knee over that. They keep on walking
And then
with that
can
also.
walk much faster. It's
So that's
not
the
like that.
they are unknowingly they are using the end weight bearing.
Okay.
That is
They're
unknowingly.
not aware.
They are not
of
aware of it, but
Yeah.
they are doing it because it is comfortable.
Overall,
It's
actually,
because it is comfortable.
overall, actually, this type of prosthesis we have to go because the stump is not ideal. The stump is not ideal for a normal functional prosthesis where you can fit it. So means always the surgeon while doing the surgery, his aim is mainly to preserve the part of the body maximum preservation of the part. So if he can go for a end weight bearing amputation in a short stump, they can remove that much part, but his credit goes there because he is saving the part of the joint, knee joint. So that is what he feels. But practically, once you want to fit a functional prosthesis, so that short stump is not suitable for a functional prosthesis. That's why we have to go for a knee bending prosthesis where the weight borne by the end of the stump. So that is Mr. Gulat is actually explaining.
इससे पहले कि हम और आगे बात करें for the knee amputation and other amputations, we'll take a short break here and we'll be right back after that.
This is Aparna. She loves chess and Shah Rukh Khan. best friend is Swati. She also has visual impairment. This is Neeraj. He plays many instruments. He loves Mohammad Rafi and cricket. He also uses crutches for mobility.
चंदा है तू मेरा सूरज है तू
This is Raj Bala.
मेरी आँखों का तारा है तू जीती हूँ मैं बस तुझे देख कर
With her husband and daughter. She loves cooking and watching TV.
सूरज है तू मेरी आँखों का तारा है तू
She also has cerebral palsy. Look beyond the disability. Look at the person.
हम होंगे कामयाब हम होंगे कामयाब हम होंगे कामयाब एक दिन ओ मन में है विश्वास पूरा है विश्वास हम होंगे कामयाब एक दिन We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We shall overcome someday. We shall overcome someday.
किसी की मुस्कुराहटों पे हो निसार किसी का दर्द मिल सके तो ले उधार किसी के वास्ते हो तेरे दिल में प्यार जीना इसी का नाम है जीना इसी का नाम है मान अपनी जेब से फकीर हैं फिर भी यारों दिल के हम अमीर हैं मिटे जो प्यार के लिए वो जिंदगी जले बहार के लिए वो जिंदगी किसी को हो ना हो हमें तो एतबार जीना इसी का नाम है जीना इसी का नाम है
The chief handicap of the blindness is not blindness, but the attitude of seeing people towards them. आइए जानने और समझने की कोशिश करते हैं कि बधिरांधता यानी डेफ ब्लाइंडनेस क्या है। बधिरांधता एक स्थिति है जिसमें दृष्टिहीनता एवं सुनने की शक्ति में कमी आती है तथा जिससे विचारों के आदान प्रदान और रोजमर्रा की आवश्यकताओं की पूर्ति में समस्या उत्पन्न होती है। बलराम एक 9 साल का बधिरांत बच्चा है। वो एक प्री मैच्योर बच्चा है जिसका शारीरिक विकास उसकी आयु के अनुरूप नहीं हुआ था। वो एक निम्न वर्गीय श्रेणी से संबंध रखता है तथा 5 साल से लगातार नेशनल एसोसिएशन फॉर ब्लाइंड दिल्ली के प्रशिक्षण कार्यक्रम से संलग्न है। इन 5 सालों के अंतर्गत उसे रोजमर्रा के कामों में, हलन चलन में, उसकी शैक्षणिक जरूरतों के अनुसार संप्रेषण द्वारा प्रशिक्षण दिया गया है जिससे वो इन सब क्रियाओं में स्वावलंबी बन सके। बलराम बिना किसी सहायता के चाकू से फलों को काट सकता है। उनके छिलकों को कूड़ेदान में डाल सकता है। अपने बर्तनों को खुद साफ कर सकता है। उन्हें सही जगह पर रख सकता है। सही बर्तनों का चयन करके खुद खाना खाता है। एवं पानी की बोतल निकालकर पानी भी पीता है। इन सभी क्रियाओं में वो टेक्चुअल साइन लैंग्वेज से निर्देशों को ग्रहण करता है और अपने भावों को व्यक्त करता है। टेलर फ्रेम और ब्रेलर द्वारा गणित, पठन लेखन में भी प्रशिक्षण प्राप्त कर रहा है। सभी बच्चों की तरह उसका भी एक मनपसंद खेल है। उसे सेल फोन को अपने कानों पर लगाकर उसका कंपन महसूस करना अच्छा लगता है। कहा जाता है, वॉकिंग विद अ फ्रेंड इन डार्क इज बेटर देन वॉकिंग अलोन इन लाइट। कहने का तात्पर्य है कि वो लॉन्ग केन ट्रेवल, टैक्टाइल पाथ, ट्रेलिंग और लैंडमार्क्स द्वारा हलन चलन में भी सक्षम है और व्यायाम संबंधी क्रियाएं जैसे ट्रेडमिल, स्टैटिक साइकिल का स्वचालन भी कर सकता है। कहा गया है, द बेस्ट एंड मोस्ट ब्यूटीफुल थिंग्स इन द वर्ल्ड कैन नॉट बी सीन और इवन टच्ड, दे मस्ट बी फेल्ट विद द हार्ट।
स्वागत है आपका आरसीआई के नवशिखर चैनल पे। आज हम बात कर रहे हैं एंड वेट बियरिंग प्रोस्थेटिक्स की और उसके लिए हमारे स्टूडियो में है मिस्टर एन.यू. मनोहर, who is consultant Department of PMR Safdarjung Hospital, and with him we have Dr. Vijay Gulati, who is a senior prosthetist in Delhi only. हेलो सर, वेलकम बोथ ऑफ यू। मैं एक बार दर्शकों को याद दिला दूं कि आप हमें कॉल कर सकते हैं, हमारे टोल फ्री नंबर पे है जो है 1800 112 008 और हमारा लैंडलाइन नंबर है 26511613 और हमारा फैक्स नंबर है 26511609। आप कॉल कर सकते हैं इन नंबरों पे और आप प्रश्न पूछ सकते हैं। यदि आपका कोई भी प्रश्न है हमारे आज के टॉपिक से रिलेटेड, तो जो हमारे एक्सपर्ट्स हैं वो आपके प्रश्नों का उत्तर देंगे। तो सर, एंड वेट बियरिंग प्रोस्थेसिस की हम बात कर रहे थे। एक जल्दी से क्विकली व्यू इफ यू जस्ट वांट टू हैव फॉर इट।
So we have got a slide over here that which shows that end weight bearing process. Which is the end weight bearing? You can see that one is the patellar tendon weight bearing, that is the for the person who has amputated below the knee, and another is at the ankle level. There is a amputation at the ankle level, so there is a weight is being borne at the end of the stump itself, amputated stump. So this is the SAMS prosthesis in which end weight bearing prosthesis, that is the end weight bearing area is being used. This is the technology which is being used for the end weight bearing. And another one is the transtibial, because we have to transfer the body weight by any means, either it's a end weight bearing or by the any other mean like a patellar tendon weight bearing. So this is the difference between the end weight bearing and the other part of the weight bearing. So there are different type of the amputations for the end weight bearing prosthesis, like partial foot amputations. There are different level of the amputation. We have discussed about it, the partial foot amputation, which includes the SAMS, Paragraph, and the ankle through ankle amputation. So that is the through ankle amputation, means SAMS amputation. After that there is a through knee amputation. So through knee amputation is another amputation which is at the level of the knee, means the rest of the knee, half of the knee is amputated. So in that case also we give a end weight bearing prosthesis if it is through knee amputation. And there is another, if it is very short below knee. Very short below knee means a little bit 1 inch or 2 inches tibia is left under the knee. In that case means we need to make it as a bend knee prosthesis to get the end weight bearing, to get the proper weight bearing of the prosthesis, we can see. So in that case we have to bend the knee and make it a bend knee prosthesis for that amputation. So in that case, other cases, the above knee amputation. Above knee means very short above knee. If it is a regular above knee or ideal stump, then we can go for a regular above knee prosthesis, which is being fitted to the most of the patients. But if it is amputated at very short level above the knee, just 1 inches or 2 inches below the hip joint itself, having a femur of 1 inches or 2 inches, so in that case means we have to use a end weight bearing by keeping the hip at the flexion position, making it resting on the ischial tuberosity. We can't bear the weight at the distal end of the any bone. Any bone means in middle of the bone, means if it is amputated, femur is amputated somewhere in the middle between the knee and the hip, means the distal end will not be able to bear the body weight. And in that case we have to bear the weight at the proximal end, which is the proximal area of the weight bearing from that distal end itself. So in that case, if it is very short above knee, then we have to go for a flexed knee, keeping it as a hip disarticulation prosthesis, or making it a weight bearing is the ischial tuberosity itself. And then there is a hip disarticulation. If someone has lost the whole of the limb, ankle is lost, knee is lost, hip is also lost, means all the three joints of the lower limb has been lost with due to any accident or any disease. If there is an amputation, in that case we have to give a hip disarticulation. So in this also, if there is a hip is disarticulated, and then after that we have got a hemic pelvectomy, means if part of the pelvis is also been amputated, hip is amputated and as well as the part of the pelvis is also amputated. In that case we have to fit a prosthesis keeping a hemipelvectomy, means we have to make a bucket and the socket around the remaining stump of the body, and then we have to fit a prosthesis to the equal length of the other side to bear the body weight and to make the patient mobile itself. That is the ambulatory system. And then we have got some of the cases congenital, means there are some by birth defects are there, the part is not grown up, or some part is underdeveloped during the pregnancy itself. After the birth, some of the children, they don't have the part of the body itself. Sometimes foot is not there, sometimes one tibia is not there, sometimes femur is missing. So these are the deficiencies are there, which are congenital deficiencies are there. So due to that also there are some requirement of the prosthetic part is also there. So in that case, these are the few cases then in which we bear the end weight bearing prostheses are being fitted. So we'll go to the detail of this. So advantages are, as I mentioned, that wide weight bearing area. So weight bearing area is wider. If weight bearing area is wider, then it is more comfortable for the weight bearing. So that's what wider weight bearing area is preferred for the prosthetic area. So we want to give as much as possible that we can give the wider area to the prosthetic fitting itself. And at the same time, if it is end weight bearing prosthesis, it doesn't require suspension, or if it is required, it's a very minimum suspension is required. Mostly it doesn't require the suspension. Within it there is a suspension system itself. So these are some causes of the amputation, which are traumatic or the accident, that is then, or cancer is there, gangrene is there, or septic, frostbite. Frostbite is very cold. It is in the, say, where there is a ice area is there. So Ladakh or the upper uphills only, where the person is all the time within the shoes and is wearing in the itself in the
Ice.
cold ice itself. In that case, the shrinkage of the our veins and the arteries is there. So blood circulation stops.
Circulation is not there.
So blood circulation is stopped over there. There is no blood circulation. In that case, one has to go for amputation itself. So loses the leg. Mostly it is those who are living in the upper hills where there is ice all the time and walking in the ice. That's why special ice shoe is required if someone has to live in the ice itself.
So are they kind of the boots that people
Yeah, the
carry?
boot has to be wear which keeps the foot warm. So we need that foot should be warm enough so that blood circulation should be maintained. So if there is no blood circulation, then that's it. And diabetic is there, sugar patients are there, and due to the diabetic, there's causes of amputations are there. So these are the causes of the amputation itself. You can see that these are the components of the partial foot prosthesis. If part of the foot is amputated, then you can see that there's a filler, that is the green color, which is shown that filler is in the front side, that 4-foot filler, whichever the part is amputated, and amputated stump, you can see the red color is that is the amputated stump. And suspension strap is only that simple strap is required. It doesn't require much of the suspension over here. And then the capsule, blue color capsule is being made in which the filler and the stump is being accommodated in the same. Over this, the patient can wear the footwear, either sandal or shoes or whatever they want. They can wear the footwear and they can walk like a normal person, or like they come back to their own normal life.
It means actually this type of amputations are like that, means the remaining part which is missing, so we are elongating it artificially, and the patient can wear a normal shoe. In the normal shoe, the gap we are filling it with the help of some synthetic material, rubber material, molded this material. So these materials are actually normally
Which
used.
are light in weight.
So means without shoe they can't walk. No, means they can
Barefoot.
walk barefoot at home also, but once the patient needs a cosmetic point of view, because nowadays the function is not enough, so you have to provide a cosmesis also. So cosmesis is more important. So this is one method what we have shown here. So that is filling the normal shoes which are available in the market. And the second one is you can also make out of silicone material, so the remaining part resemblance to the shape of the
Other foot.
Will show the toes, will show the nails also in that, and that is fitted to the patient. And the whole thing the patient can also use in a normal shoe, so they can walk without a shoe, so they can walk with a shoe also. So that is the latest technology actually.
But even then, without shoe, we prefer them to walk for very little distances, because if they walk so frequently with the barefooted, without any footwear, the silicone which is being used, that can wear out, and that's very expensive.
Okay.
So they have to take care of that part also. There is a particular part.
So sir, usually when a prosthetic, he designs an artificial limb for somebody, so does that body weight also plays a major role?
Yes.
Yes.
Everything has to be considered before prescribing any prosthesis for any person who has lost a limb. That age factor, gender, male, female, or say weight is there, and the profession, what kind of the work they want to do it, that is also important.
The living environment.
Living environment is required, where they are living, either they are living in the rural or the urban area, what kind of a process and what kind of the job they are going to do after the fitment of the prosthesis. That is also important, because we have to rehabilitate them completely. So he has to go back to his own work or job wherever they want to go. So we have to consider that also, what kind of the work they want to do it, and then economical condition also, how much money they can spend, or what kind of the unit we can prescribe for them. If we prescribe them an expensive one, it will be difficult for them to bear the cost also. So we have to consider their economical condition as well. So everything that we have to consider, and family member, how many members are there, so who is going to support them. So everything has to be considered with that.
So why this gender factor needs to be considered?
See, gender factor means it's a see one thing. It's some of the ladies, if they are at home, means they are not going outside only. They will be living in the home itself. See, environment, everything we have to see. If we go for rural ladies, they just everywhere. Some of the ladies, they are at home, and some of the ladies, they go for work also. So if they are at home only, their movement is limited, then we have to select such a prosthesis which is required for a limited movement itself. If they are active, then only we have to select a prosthesis which allow them to walk freely for any distances. So that's what is required. So they have an old age. We can understand that if age is old, then they are not going to run. They are not going to move very fast. They are not going to move as a young person do. So these are the things that we need to consider.
Means these selections actually is to minimize the expenditure. Number one.
And give more comfort.
Then the materials what you are going to use. If you want to minimize the expenditure, means the quality of the material is different. And if you want to go for high-fi expenditure type, expensive type, and more cosmesis point, and that material is totally different. The cost of that material will increase, and the cost of this material will decrease. So that's why we have to see all the criteria actually. That's actually how to select is not that easy actually. You have to make the patient comfortable, you have to make the patient walk, you have to see the cosmesis point of view, you have to see the functional point of view, you have to see the environmental point of view, you have to see the financial point of view. Means each and everything you have to find out before selecting a prosthesis.
See, for example, see, there's a foot piece. You know about the Jaipur foot? Everyone know about it. Jaipur foot is say around 250 or so, that cost. And there's a foot piece which cost about 1 lakh rupees also.
Okay.
So if we give that foot piece which costs 1 lakh rupees to any rural person, it's useless for him. The 250 wala is much better for him. He can walk barefooted and doesn't have any maintenance. No, if it is worn out, then he can replace it easily. Another 250 rupees he can spend for that foot, and he can be replaced itself. And whereas that we are talking about 1 lakh rupees of a foot piece, means the person use it for the running purpose. Sports person, they use this kind of the foot pieces. So once the old person is there, then he is not going to run. Then there's no need of giving that such expensive foot piece for them. So selection of the material, selection of the component, totally based on the assessment of an individual patient. After getting all that, as we have mentioned, everything, each and every aspect has to be considered for the selection of the components for the fitment of the prosthesis.
So is there any specific period of time, sir, after which we need to change the artificial limb?
No, of course, there is wear and tear in the artificial limbs.
Okay.
So mainly in children, the frequent changes are required because the growth is there. So growth point of view, every 3 months, 6 months, the patient has to come for follow-up. So we have to check it. If the patient is grown up, the height is increased, circumference of the stump is increased, then we have to change the socket. It's like that. In adult cases, so these points are not there. In adult cases, these problems comes only if the patient is put on some weight, then the socket is become tight, so he is unable to wear it. So that time the socket replacement, and other parts, the remaining parts, you can use it, so that is not spoiled. And in wear and tear, so
Wear and tear
sometimes means uneven surfaces of the patient is walking more distances like that. On the stones he is walking, and hilly areas he is walking. Then there are chances of breakage of foot pieces. So once the foot is broken means you can't repair it. You have to replace it, that particular foot. The nowadays, the olden one we used to repair it, the wooden foot pieces. The remaining part means the broken part, will take it out and we can repair it. So, but the latest technology, we have to replace the foot pieces. It's like that. And sometimes the lining part is there. Sometimes the suspension means to hold the prosthesis, the straps what you have provided, that wear and tear is there. Due to perspiration, the climate conditions, our Indian conditions, the inside lining part that got damaged, so that part is there. So
And we have seen some of the cases. There's maintenance. How do you maintain them? If there is say minor problem, you should rectify immediately. Don't wait for a long time. Once it takes a say bigger part of the complaint, then it means आपको पहले से ध्यान दे के रखो कि खराब होने से पहले ही you keep it, make it clean, keep oiling and everything wherever it is required. You should do that and maintain it properly. If you are maintaining properly, means you can keep it for a long time. If you are not maintaining anyway, आप सुबह उठे और पहना और चल दिए, पहने और चल दिए, you don't have time to just look for this, then this may get spoiled faster than.
Like you are changing your normal shoes.
Everything that you need.
So, like that. You can also keep a prosthesis spare also, standby.
Okay.
If some repairs come, you can switch on to other one. You can go for this, give it there for repairs. It's like that. That is also there. We are also changing our clothes. So like that.
That maintenance thing is equally important.
Maintenance is equally required. That you have to go for a maintenance, not so frequently. Maybe once in a year, maybe once in 2 years. That depending on your and also depend on the your walking. How much do you walk? दिन भर में कितना चलने का काम है आपका, कितना चलते हैं, उसके हिसाब से अगर आप चल जा रहे हैं, खूब यूज़ कर रहे हैं, then you may require more attention for the prosthesis also. जितना आप उसका ध्यान रखेंगे, that will support you. पूरा आपको मदद करता है इसके साथ में. And these days prostheses are available in most of the centers in throughout India. There are so many DRCs and rehabilitation departments in each and every hospitals are there. So everywhere they are producing. There are so many thousands of NGOs, those who are working under the Ministry of Social Justice and Empowerment. They are providing the artificial limbs under the ADIP scheme also. So these are the different areas where they can get the prosthesis, they can get the repair, they can get the maintenance of the prosthesis. They should contact any say prosthetist who is the authorized or who is the specialist for
it is always advisable they should go to a qualified prosthetist for getting given maintenance. So they are easily available in every place nowadays. Actually, that problem is. So previously the scarcity was there, so they have to go for a longer distance to find out a rehabilitation centers or prosthetic orthotic centers. So now it is not that problem. So every district they will find it.
So I guess that's useful information for our viewers.
Yes.
In so case they want to go for it, so they can contact different NGOs also as
yes,
you
NGOs
mentioned.
also there.
Okay. So sir, we were discussing about the foot prosthesis. So shall we come on to the knee prosthesis now?
Yes, definitely we. See, this is the in case of very short below knee amputation that you can see that. So this is the below knee stump which is very short. So what do? We bend the knee. Knee is being bent, and in case of very short transtibial or the below knee amputation, or there is another reason. Below knee amputation means loss of muscles, is lot of muscles are lost. So for the comfort, the patient, they keep the knee in a flexion position, and they don't do the exercise with that remaining stump of that. So in due course of time they develop the contracture at the knee level. So we are not able to correct the knee bring the knee in a straight position. So in that case, we have got a only option that we bend the knee in a 90-degree and make it as a bend knee prosthesis, which
as
is
you had
end
mentioned
weight.
earlier.
Yeah, that is the thing. In that case, even the stump is long. If stump is short, then we have to do it. But if the stump is long and it has developed a flexion contracture of the knee, then in that case we have to keep the knee in a flexion position and make it as a bend knee prosthesis. That is more comfortable for the patient, because if we advise the patient for the further surgery of the release of the contracture, patient may not go for the surgery also.
The prosthesis, what you are seeing, the knee bending prosthesis, bend knee prosthesis, this is not for cosmetic point of view actually. Just to make the patient ambulatory, the remaining part in whatever shape the leg is there. So in that shape, we are trying to make a prosthesis where you can make the patient stand, you can make the patient walk with the same thing, but cosmetically this is not acceptable to all.
You can see in
इससे पहले सर हम आगे नी प्रोस्थेसिस की बात करें, यहाँ पे लेते हैं हम एक छोटा सा ब्रेक एंड विल बी राइट बैक आफ्टर दैट.
हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन. ओ मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We shall overcome someday. We shall overcome someday.
कोई मुश्किल हो, दूर मंजिल हो, never stops us from dreaming. हारता है वो, हार माने जो, we are what we believe in. हम धरती को अंबर से मिला दे, हम उड़ सकते हैं, उड़कर दिखा दे, हम छू ले सितारों को. आशा के पंखों पे we can and we will fly. We can and we will fly.
This is Aparna. She loves chess and Shah Rukh Khan. Her best friend is Swati. She also has visual impairment.
La 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 la.
This is Neeraj.
La la हवा धीरे धीरे चल रही.
He plays many instruments.
सुनो जो कहानी
He
कह
loves
रही
Mohammad Rafi
है.
and cricket.
ये कहानी सदियों पुरानी है, ये कहानी हमें सुना.
He also uses crutches for mobility.
धीरे धीरे
चंदा है तू, मेरा सूरज है तू,
This is Raj Bala.
मेरी आँखों का तारा है तू. जीती हूँ मैं बस तुझे देख कर.
With her husband and daughter. She loves cooking and watching TV.
सूरज है तू, आ मेरी आँखों का तारा है तू.
She also has cerebral palsy. Look beyond the disability. Look at the person.
वेलकम बैक आफ्टर द ब्रेक पे जाने से पहले हम बात कर रहे थे डिफरेंट एम्पुटेशंस की, जिसमें हमने बात की पार्शियल फुट एम्पुटेशन की, साइम्स एम्पुटेशन की हमने बात की थी. देन वी टॉक्ड अबाउट नी एम्पुटेशन, वेरी शॉर्ट बिलो नी एम्पुटेशन की बात की थी. देन वी टॉक्ड अबाउट वेरी शॉर्ट अबव नी एम्पुटेशन ऑल्सो, हिप डिसआर्टिकुलेशन एंड हेमी पेल्विक एम्पुटेशन एंड कंजेनिटल डेफिशिएंसी. इसके बारे में हमारे एक्सपर्ट्स हमें ब्रीफली बता रहे थे वन आफ्टर अनदर. Then we talked about that once a person has been done with the amputation, then what are the what are the precautions that he needs to take, like maintenance factor is there, different environmental factors are there, age की हमने बात की थी. सर हम बात कर रहे थे नी प्रोस्थेसिस की ब्रेक पे जाने से पहले.
Bend knee
प्रोस्थेसिस की.
You can see the slide. You can see the slide, which is a person in the rural area. He developed at his own skill, whatever the skill he had. एक विलेजर है, गांव का आदमी है, और उसने जस्ट देखिए, he has bent the knee. On the right side you can see using bend knee prosthesis. The stump is long enough, ideal stump, which can be fitted to a regular prosthesis also. But he didn't have an idea about it. But only the thing, he was sure about it that he can stand on the knee if he bend the knee, because kneeling, everyone knows about that, kneeling can be done. So he knew about it, and he bent the knee and kept a pad over there at the height of the knee itself, and he was walking with this for a long time. But when we visited that village to conduct a camp over there, so we found that we can fortunately he had not developed any contracture. उसके टांग के अंदर जो है contracture बनने की बात हो रही थी, जो पहले बताया था मैंने, लंबा मोड़ के रखने से क्या होता है, फिर contracture बन जाते हैं. बट इस केस में उसको contracture नहीं हो पाया था. वो he was एक्टिव एनफ, बहुत अच्छी मूवमेंट करता था, चाहे काफ़ी उम्र है उसकी, लेकिन फिर भी अच्छे से चलता था. तो नी उसका सीधा हो जाता था. तो वी मेड ए रेगुलर प्रोस्थेसिस फॉर हिम ऑल्सो. सो ही हैड बोथ द ऑप्शंस विद हिम. एक रेगुलर प्रोस्थेसिस भी यूज़ कर सकता था जो पेटलर टेंडन बेयरिंग था, एंड दूसरी साइड पे बेंड नहीं करके उसको बेंड नहीं प्रोस्थेसिस लाइक एंड वेट बेयरिंग प्रोस्थेसिस, वो दोनों ऑप्शन उसके पास. ही वॉज यूजिंग बोथ द ऑप्शंस इसके लिए. तो ये उसके लिए काफ़ी कंफर्टेबल हो गया. यू कैन सी दैट गांव में तो ये इट्स वेरी कॉमन कि अपने क्रच के ऊपर ही दे डू द अमेंडमेंट इन द क्रच इटसेल्फ. क्रच के अंदर बैसाखी के साथ ही उस लेवल के ऊपर नी के लेवल पे नी को मोड़ के एक प्लैंक लगा देते हैं, उसके ऊपर अपना नी रेस्ट करके दे मेक देमसेल्फ वॉक इटसेल्फ. अब नहीं होता है तो नी हिप को रेस्ट करने के लिए एक लकड़ी लगा देते हैं और वो उसके साथ भी चलते हैं. So these are the things that which are being adopted by the local people also. But we do, once the expertise is there, then we can give them a expert advice also to make them look like a normal person, because only the cosmetic purpose you can see. The function was he was able to walk with that also, but in the regular prosthesis he was given a natural look also with the normal prosthesis.
सर अभी आपने कॉन्ट्रैक्चर्स की बात की. सो सपोज कॉन्ट्रैक्चर्स फॉर्म हो गए, सो देन व्हाट आफ्टर दैट?
Two options. I will let you know. The contractures actually developed because of the faulty postures. If any part of the body remains for a longer period, in particular one position, so then the muscles get tightened, the tendons are tightened, and if you don't use the muscles, so that will become tight, so that it is not possible to stretch it afterwards. Then he has to go for rigorous exercise therapy. He has to go for physiotherapy department, and they have to go for exercise therapies. And if exercise therapy is also helpful only in those cases where the contracture is stretchable. There are two types of contracture. One is permanent fixed contracture. One is stretchable contracture. If it is stretchable, then they can go for exercise therapy, and that he got it stretched. Then you can go for a normal prosthesis in that. If the fixed contractures are there, then the patient has to go for surgical correction. So the patient has to go. Surgical correction means they will cut the tendons and they will keep the leg in plaster for 4 to 6 weeks in neutral position. Then the patient will come back, then he will go for regular exercises again to strengthening the muscles. And after strengthening the muscle, then the patient will come to prosthetics. Then we have to take the measurements and we have to fit a normal prosthesis. So
this is
the
the one
difference
option.
actually.
And the other option, if he doesn't want to go for any surgical correction, then we can just bend the knee and
above the level you can go for it.
you can just keep the
Another
stump.
amputation.
That is the
Okay.
we call it as a accommodation of the prosthesis. We do the accommodation of the contracture. We do the accommodation of the condition of the stump.
This is means we are accommodating the part
Condition.
as it is conditionally.
Whatever the
Means
condition
we are
is
not
there,
giving
we
for
try to
cosmetic
accommodate.
point of view, but we are making the patient ambulatory. The wherever
There
the
are
patient
very few patients they go for the constructive surgery or for the corrective surgery. They don't go for the corrective surgery.
Normally rural area patient they will never
They
go.
don't prefer. Means
Once the
surgical means
patient,
they are scared of it.
Patient
They
needs
don't
a
want to go
cosmetic
for it.
one, then he will definitely go for that painful procedure actually.
Okay, so sir, what after bare knee prosthesis?
There is another level of amputation at the knee level, that is called through knee amputation. That is the through knee amputation, which is same, the conditions are the same, maybe accidental or the disease, any of the disease itself, but the level of amputation is just at the knee level itself,
And
keeping
if
the
you-
flap over
means
there.
if you want to compare it, the same bend knee prosthesis, if you remove it through knee level, if you want to get rid of that
Bend knee or
bend
the-
knee portion, and if you want to go for a cosmetic type prosthesis, so then the next option is, so this is a through knee amputation. So this is again end weight bearing.
So is
So-
this the below knee amputation
No,
sir,
no,
or
no.
above?
This is
It's a through knee.
Through knee
Yeah,
means
it's a
this
through
comes
knee.
to above knee because the lower knee portion is absent.
Okay.
So the knee muscles are not there. The one,
femur
the
bone
long
is-
bone, the femur bone,
Complete bone is there,
which comes in a
having a
bone.
bulbous end.
So that
and,
is remain.
Only the thing that the tendon has to be stitched under it so that it should be able to bear the weight, as we were talking about the patellar tendon and other tendons. So those tendons still we require under the distal end of the stump, so that it should be weight bearing. Like he mentioned earlier also, if the end is not able to bear the weight, then we have to go for another option, a higher level of the weight bearing area. So that's why we need a good amount of muscles at the knee level also to make a patient able to bear the weight at the distal end itself. So once the distal end, you can see the one of the stump itself, that one is the level of the knee and the stump level is there. So in that case, we need to keep the stump healthy at the distal end, so that whole body weight should be borne on the, you can see in the slide itself, that is the distal end. You can see very clearly at the knee level, whole muscle is there and femur bone is saved over there, and this is the rest of the part, because end weight bearing is, again I will repeat that end weight bearing is more comfortable, more because the weight bearing area is wider. So that is the area is broader area, then good amount of weight can be transferred whole of the stump itself, distal end.
Even in this amputation also, there is one disadvantage. Some patients are more sensitive. The end of the stump, the condyles of the bone of the femur are more sensitive, so they are unable to bear the weight at the end of the stump. So in those cases, there is one more amputation is there, that is also known as gritty stroke amputation. So there, one bone is there at the knee, that is known as patella. A round piece is there, bone piece. So that patella is preserved at the end of the stump through the knee. Through the knee, the end of the stump is, the patella is fused and it is stitched at the end of the stump. So that is a 100% end weight bearing stump. Because in kneeling, actually, while kneeling, if you are walking, so that is the part where you are bearing the weight actually in kneeling. So the same principle is used here. So through knee means the patella is not there, and if you preserve the patella, so that is the name of the amputation is again changed. So that is gritty stroke amputation. So if it is not, then the patella is also not there. the end of the part is sensitive, then the weight bearing part will go to upper area. Then you have to go for ischial
It
tuberosity.
becomes more complicated. That means it's a long stump.
It is a long stump, but it's useless stump for us because the end weight bearing is not there. Then you have to go for above knee level type.
So that's why the stump should be very healthy, and it should be planned. Nowadays it is amputation is being done by the surgeons in a planned way, that because they are now well aware that the person has to go for the prosthetic fitment after the surgery, after the amputation of this stump. So they make the stump in such a way that it's an ideal stump for the fitting of the prosthesis. So we need an ideal fitting for the good fitting of the artificial limb. That is in the favor of user as well as the person who is working on that patient itself. So that's what we need. This is the knee disarticulation, which is end weight bearing prosthesis, in which we have got two forms like end weight bearing prosthesis and knee disarticulation, and another one is the gritty stroke, in which the patella is being preserved under the distal end of the stump itself. See this, in this case you can see the components which we have got the knee disarticulation prosthesis. In that you can see the patient who is wearing the prosthesis, having a stump, long stump and a healthy stump, putting on a socks with that soft lining, and it has got a socket, knee unit, then shin part and the foot and ankle which we require for the components which can be fitted to the prosthesis. So in this case patient is free to walk with the free movement, with some limitations like sweating is not possible, cross leg sitting is not possible. So these are some of the limitations are there in each and every prosthesis.
But are they flexible enough to walk?
Because this
For
is
walking,
a
yes.
long stump, so Western style he can use everything. He can sit on a chair, he can sit on a bench, he can sit on a table. He can bend the knee up to 90 degrees. Beyond that also little bit means he can go 10 to 20 degrees more. But he can't sit on a lower level actually.
Okay.
So that flexibility means for that particular point of view you won't get that margin actually. So that is
So there are some limitations. One has to compromise with this. Earlier also we have mentioned that prosthetic fitting is not a total replacement of the body movements. It's a replacement up to the some limit. Up to that the person is ambulatory only, can do their perform their activities of the daily living. They can do it with some modification, with some somewhere they have to compromise also with the, or somewhere they have to alter their way of living also. अपना रहने का रहन सहन भी थोड़ा सा बदलना पड़ता है उसके साथ में हिसाब से, और ये सब चीज़ें जो है उनको एज पर देयर रिक्वायरमेंट, बिकॉज दैट इज द नेसेसिटी. इसकी ज़रूरत है, इसलिए हम उसको एडवाइस भी करते हैं, उनको बताते हैं इस तरह से करिएगा, क्योंकि जिस तरह की ज़रूरत जो हम उनको प्रोवाइड कर सकते हैं उसके हिसाब से ही उनको अपना लिविंग स्टाइल थोड़ा सा चेंज करना पड़ता है. साइकिलिंग करते हैं या स्कूटर चलाते हैं या क्या करते हैं, सो ये सब चीज़ें जो है उनके लिविंग स्टाइल के अंदर आती हैं. कार चलाते हैं, जैसा भी उनका प्रोविज़न है, तो अकॉर्डिंगली उनको अगर मान लीजिए लिम्ब को यूज़ नहीं कर सकते हैं कार चलाने के लिए, देन दे हैव टू गो फॉर अनदर ऑप्शन ऑफ दैट. नाउअडेज कार जो है हैंड ड्रिवन में भी आता है पूरा सब उसके अंदर. सो ओनली द थिंग दे हैव टू कंप्रोमाइज विद द लिविंग स्टाइल ऑल्सो. So these are the things that we have to do, but only the thing, cosmesis is not so important in the lower extremity, whereas everything is being covered in the pajama and the trouser itself, or the salwar or the sari itself. So only the thing that functional ability, that is more important. They should be able to walk freely, they should be able to walk without any support or with a minimum support, and some of the, depending on the level of amputation. बिकॉज जैसा कि मैंने बताया था कि जितना लेवल हायर जाता है उतनी कॉम्प्लिकेशंस बढ़ जाती हैं. सो इफ़ द कॉम्प्लिकेशंस आर मोर देन वन हैज़ टू यूज़ अ स्टिक और सम सपोर्ट फॉर वॉकिंग. इट इज़ सेफ टू यूज़ अ स्टिक इफ़ द केस इज़ अबव द नी और over that level of amputation, say hip disarticulation or so, it's better to use any stick which gives the support to the user. एक यूज़ करने वाले को थोड़ी सपोर्ट तो देती है, साथ में साथ चलने वाले को या दूसरे आदमी को ये भी इंडिकेट करती है कि द पर्सन इज हैविंग सम प्रॉब्लम विद द लेग. सो वन हैज़ टू बी केयरफुल वॉकिंग नियर टू हिम ऑल्सो, क्योंकि किसी की गलती से भी अगर उसको धक्का लग गया, या कोई आज के टाइम में इतनी फास्ट लाइफ है, लोग तो दौड़ रहे हैं, तो भीड़ भाड़ वाला इलाका है, जहाँ पे गए हैं, मार्केट में गए हैं, कहीं भी हॉस्पिटल में हैं, अगर आप इस तरह से चल रहे हैं और बिना स्टिक के, आपने किसी को क्या मालूम ट्राउज़र के अंदर कि आपके पैंट के नीचे आर्टिफिशियल लेग लगी है या नॉर्मल लेग है, नो वन नोज अबाउट इट। हाँ, आप चल रहे हैं तो चलने से थोड़ा लंगड़ाएंगे या कुछ ऐसा लगेगा तो पता लगेगा। अगर आप नॉर्मल चल रहे हैं आर्टिफिशियल लिम्ब के साथ में तो किसी को जज भी नहीं हो पाएगा, तो कोई अगर आपको पुश कर देगा देन योर बैलेंस कैन बी लूज। आप बैलेंस लूज करेंगे तो गिर भी सकते हैं, गिरने से चोट लगेगी, चोट लगने से और भी कॉम्प्लिकेशन आपको बढ़ जाएंगी। तो बेहतर है कि हैव ए स्टिक, कुछ भी एक हल्की सी सपोर्ट हाथ में रखेंगे विच गिव्स यू सपोर्ट एंड गिव्स द इंडिकेशन टू द अदर पीपल जो आपके साथ चल रहे हैं, उनको भी इंडिकेशन रहता है कि इनको कुछ प्रॉब्लम है, तो थोड़ा सा आपके साथ में क्लोजली या थोड़ा दूर डिस्टेंस बना के चलेंगे आपके साथ में।
So suppose somebody is provided with this artificial limb thing, so initially he may not be very comfortable walking with it. So do they require any proper kind of training or something
yes,
like this?
There is different stages are there.
Okay.
Once you provide any artificial limb to any type of level of amputation, first we will give the fitting of the socket, then you will make the patient stand in the parallel bars actually.
Okay.
With the help of parallel bars you will make the patient stand. So during weight bearing, wherever the patient gets any pressure points, so he will complain to us, we will try to remove the problems actually. So once the standing balance is good, then we will make the patient walk in the parallel bars with support, with both the hands. So that is another stage. Then again in the same parallel bars, holding one bar, leaving one hand. So that is one more stage. Then in the same parallel bars, without holding the bars, he will feel secure, the bars are there. If he feels unstable, immediately he will try to hold it. So like that, we will make the patient walk without holding the parallel bars. We can make the patient walk outside the parallel bars with the help of pair of crutches. We can also make the patient walk with the help of a walker. So these are the different stages. Then we make the patient walk with the help of a stick. Then we will make the patient walk without any support. So these are the different stages are there. We will also teach them how to climb up the stairs, how to come down from the stairs, how to walk on a slope areas, how to climb up the ramps. So these are all different stages we have to teach them. We will also teach some of the patients how to cycling with artificial limb. On rural point of view, you have to think in that way also. So all these stages, once the patient is got the proper training and you are happy with his performance, the patient is happy with his own performance and he feels more stable, then only will deliver the final
and this based on
actually.
Totally it is based on that the efforts of the user. जो आर्टिफिशियल लिम्स के यूज़ करने वाले हैं उनके एफर्ट्स, उनकी विल पावर, उसके ऊपर बहुत ज़्यादा इसका श्रेय जाता है, उनका बहुत कंट्रीब्यूशन होता है इसके अंदर। अगर उनकी विल पावर अच्छी है या उनका एंथुजियाज़म अच्छा है, वो बहुत कोशिश करना चाहते हैं, उसके ऊपर बहुत डिपेंड करता है सारा कुछ। हमारे या थेरेपिस्ट या कोई भी प्रोफेशनल उनको इतना ट्रेन नहीं कर पाएगा जब तक वो खुद के एफर्ट्स को उसके अंदर नहीं डाले।
In other words, practice made the man perfect. So that is also
उसके लिए यही होता है कि जो
for example, if you see in the circus, the person is walking on a rope.
Yeah.
So that is only practice, nothing else. In the same manner, a patient can also walk with an artificial without any support.
So we have got different type of the persons. Those who are really working on that. Some of them they are very active. They walk like anything. जिनको कभी पता भी नहीं लगता है. And we take them as a example for the others also. हम उनको encourage करने के लिए बुलाते हैं, उनको कहते हैं कि आप दूसरे यूज़र्स को आप encourage करिए, बताइए इनको कि आप कैसे चलते हैं, कैसे मेंटेन करते हैं, ताकि उन लोगों को भी थोड़ा सा एक हमारे से ज़्यादा उनका विश्वास करेंगे वो लोग, जो यूज़र होगा। हमारी बात पे इतना विश्वास नहीं करेंगे जितना विश्वास वो जो यूज़र की बात के ऊपर विश्वास करेंगे कि ये जो कह रहे हैं।
person wearing a prosthesis and walking without any support, then they are more motivated.
उनका ज़्यादा इसके ऊपर हो जाता है कि देखिए ये कर सकता है तो
मैं भी कर सकता हूँ। For example, if you see the Sudha Chandran,
Yeah.
the actor, so she is also
she's
done
one of the most popular examples that we have.
Everyone can see. उनको दिखाने की जरूरत नहीं है, हर कोई देख सकता है उनको कभी भी किसी मूवी में किसी सीरियल के अंदर।
You have to motivate them like that actually.
So there are many people like her. बहुत सारे ऐसे लोग हैं, लेडीज हैं, मेल हैं, फीमेल हैं. They are really working with that. बहुत अच्छे से काम कर रहे हैं, बहुत बढ़िया चल रहे हैं, बट देयर आर मैनी अदर्स ऑल्सो दोज हु आर नॉट एबल टू परफॉर्म like these people also. ऐसे भी लोग हैं, बट स्टिल वी फील दैट दे शुड पुट देयर एफर्ट्स, उनको अपनी कोशिश करते रहना चाहिए, एंड डेफिनेटली अगर वो कोशिश करेंगे तो वो भी अचीव कर सकते हैं. कुछ भी मुश्किल नहीं है, कुछ ऐसा काम मुश्किल नहीं है जो देखिए वो कर सकते हैं तो आप क्यों नहीं कर सकते. तो इसके अंदर एजुकेशन और क्वालिफिकेशन वाली कोई बात ही नहीं है. जिससे सिंपल थिंग, द वन हैज़ टू लर्न विद द रेजिडुअल लेम ओनली. जो बचा हुआ है उसके साथ ही चलना है, दैट इज द ओनली थिंग. वन हैज़ टू लर्न, वी लर्न सो मेनी थिंग्स इन आवर लाइफ. साइकिल चलाना भी सीखते हैं, स्कूटर चलाना भी सीखते हैं. सो यू हैव टू बैलेंस योर सेल्फ ओनली. सो दिस इज़ द थिंग. ये भी एक ऐसा है कि आपको बैलेंस इसके ऊपर करना है. अगर वो अच्छे से बैलेंस करेंगे तो दे कैन डू इट इन अ बेटर वे.
मैं एक बार हमारे व्यूअर्स को और याद दिला दूं कि आप हमारे एक्सपर्ट से क्वेश्चन कर सकते हैं आज के इस टॉपिक से रिलेटेड. आप कॉल कर सकते हैं हमारे टोल फ्री नंबर पे विच इज़ 1800-112-0008. हमारा लैंडलाइन नंबर है 265-11613 और हमारा फैक्स नंबर है 265-11609. तो सर, आफ्टर दिस थ्रू नी amputation we'll discuss about the very short above knee prosthesis.
Yeah, very short above knee prosthesis. See, this is another prosthesis in which we have discussed about that. अगर स्टम्प छोटा होता है तो उसको एकोमोडेट करना या उसको उसी तरह की ग्रिप देना ज़रा मुश्किल हो जाता है. खाली मुश्किल प्रोस्थेटिस्ट के लिए नहीं है, मुश्किल यूज़र के लिए भी होता है. वेट बेरिंग एरिया लेना उसके लिए मुश्किल होता है, एकोमोडेट करना मुश्किल होता है. उस केस में हम इसको एक छोटी स्टम्प अगर होती है उसको फ्लेक्स करके फ्लेक्शन पोजीशन में ले लेंगे और उस पोजीशन में लेके देन वी मेक अ सॉकेट एंड वी डू द प्रोस्थेटिक फिटिंग इन दैट केस. सो उसके अंदर जो हम प्रोस्थेसिस बनाते हैं दैट इज़ एक सॉकेट तो हर प्रोस्थेटिक के अंदर बनेगा, बट द डिज़ाइन एंड द शेप ऑफ द सॉकेट विल बी एंटायरली डिफरेंट फ्रॉम ईच अदर. जैसा जैसा स्टम्प होगा वैसा वैसा उसका सॉकेट बनाया जाता है. ठीक है ना. सो फॉर वेरी शॉर्ट प्रोस्थेसिस जो बेंड नी प्रोस्थेसिस हो गए, बेंड फ्लेक्स नी फ्लेक्स हिप वाली जो आएगी, जो बहुत छोटी अबव नी प्रोस्थेसिस है, छोटी स्टम्प है, उसको फ्लेक्शन में रख के एक छोटा सा सॉकेट जो आप देख रहे हैं स्लाइड के अंदर, एक सॉकेट बनाना पड़ता है जिसके अंदर उस रेजिडुअल पार्ट ऑफ द बॉडी जो स्टम्प बचा हुआ है बॉडी का उसको एकोमोडेट किया जाता है, उसको कंफर्ट दिया जाता है, अंदर उसको सिट के बैठा दिया जाता है ताकि वो अंदर उसके बैठ जाए. और उसके बाद ही उसके रेस्ट ऑफ द कंपोनेंट्स अकॉर्डिंग टू द रिक्वायरमेंट. जैसे हिप जॉइंट चाहिए तो हिप जॉइंट लगाना पड़ेगा बिकॉज वी नीड द मूवमेंट. हमें चलते वक्त हिप की मूवमेंट, फ्लेक्शन और एक्सटेंशन चाहिए होता है. तो एटलीस्ट अदरवाइज हमारे हिप के ऊपर बहुत सारी मूवमेंट है, फ्लेक्शन एक्सटेंशन है, एबडक्शन एडक्शन है, सर्कमडक्शन है, देयर आर डिफरेंट टाइप ऑफ द मूवमेंट्स. बट सारी मूवमेंट्स ना देख के विच इज़ वेरी एसेंशियल फॉर वॉकिंग पर्पस. सो एसेंशियल इज फ्लेक्शन एक्सटेंशन. आगे तो चलना ही है हमने, वॉकिंग करने के लिए हमें फ्लेक्शन और एक्सटेंशन की ज़रूरत पड़ती है. तो उसके लिए हमें एक हिप जॉइंट देना पड़ेगा जो हमें परमिट करे उसको प्रोस्थेसिस को आगे और पीछे चलने के लिए, फ्लेक्शन और एक्सटेंशन देने के लिए हमारा एक हिप जॉइंट चाहिए होगा. देन वी हैव टू फिल हिप जॉइंट के साथ में वी हैव टू गो फॉर अ थाई पार्ट विच विल compensate the which lost thigh part itself and up to the knee level, because at the knee level again we have to give a knee unit. क्योंकि जो आदमी ने प्रोस्थेसिस यूज़ करनी है उसको बैठना भी है, चलते रहना, हर वक्त खड़े रहना और चलना नहीं है. वंस द पर्सन वांट्स टू सिट मीन्स नी को फ्लेक्शन में लेना पड़ेगा, नी मोड़ना पड़ेगा. हम अब चेयर पे बैठे हैं तो हमारे घुटने मुड़े हुए हैं, हिप मुड़ी हुई है, सो हिप शुड बी इन अ फ्लेक्शन, हिप जॉइंट दे दिया हमने. नी शुड बी इन फ्लेक्शन, वी हैव टू प्रोवाइड ए नी जॉइंट एट दिस लेवल. एंड to compensate the rest of the part from knee to the foot, in between the foot we have to provide a shin part which will be filling the gap between the knee and the foot ankle. So we have to give a shin part over there. Under the shin part we have to fix a foot and ankle. In this we have got a variety of the components. We have got different type of the knee unit, we have a different type of the foot pieces, we have got a different type of the hip joints. These are the components which you have got in a different type of the thing that again is based on the requirement of an individual person. जैसा आदमी औरत जैसा भी जिसको चाहिए, उनकी क्या एक्टिविटीज़ हैं, क्या करना चाहते हैं, क्या अचीव करना चाहते हैं, उनकी मदद के, उनकी ज़रूरत के हिसाब से हम उनके कंपोनेंट्स को सिलेक्शन करते हैं. तो उसी के बेस के ऊपर हम जो सिलेक्शन होगा कंपोनेंट्स का, वी कैन डू द फिटिंग. एंड पर्टिकुलरली फॉर द फिटमेंट के लिए भी कौन से कंपोनेंट उनको ठीक रहेंगे, दैट एक जो क्वालिफाइड प्रोस्थेटिस्ट होगा वो उनको पूरी जानकारी देगा उसके बारे में. और पूरी जानकारी लेने के बाद ही द पर्सन हैज़ टू सेलेक्ट दोनों को बैठ के आपस में सिलेक्शन लेना होगा कि मैं किस तरह के कंपोनेंट्स के अंदर कंफर्टेबल रहूँगा, क्या मेरे को उसमें बेनिफिट मिलेंगे, क्या नुकसान भी होंगे, क्या मैं नहीं कर पाऊँगा। नुकसान तो यही होगा क्या नहीं कर पाएंगे, क्या कर पाऊँगा और क्या नहीं कर पाऊँगा। इसको अगर ठीक तरीके से बोला जाए तो ये होगा क्या एक्टिविटीज़ कर सकते हैं या क्या नहीं कर सकते हैं। तो इनके ऊपर उसको यूज़र को डिसाइड करना होगा कि नहीं मेरे को ये करना ज़रूरी है, ये नहीं करूँगा तो भी चलेगा। सो लाइकवाइज वी हैव टू गो फॉर ए सिलेक्शन ऑफ द कंपोनेंट्स। सो इनके डिफरेंट कंपोनेंट्स हैं, उनके ऊपर सिलेक्शन करके देन वी कैन गो दैट।
इससे पहले कि हम हमारे डिस्कशन हमारे एक्सपर्ट्स के साथ आगे बढ़ाएं, यहाँ लेते हैं एक छोटा सा ब्रेक और मिलेंगे ब्रेक के उसके बाद।
ऑटिज्म एक व्यापक विकासात्मक विकलांगता है जिसके लक्षण जीवन के प्रथम 3 वर्ष में ही दिखाई पड़ते हैं, जैसे असंगत खेल, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं, शाब्दिक संकेतों पर अभिव्यक्ति न देना।
देखो, ओपन योर आईज, ओपन करो, ओपन करके ओपन।
नियमित कार्यक्रम परिवर्तन का विरोध करना एवं अवलोकनीय शारीरिक उच्च स्तरीय या निम्न स्तरीय क्रियाकलाप। UNCRPD 2007 सेक्शन 1 ऑफ आर्टिकल 4 निशक्तता के क्षेत्र में कार्यरत प्रोफेशनल के प्रशिक्षण पर महत्व देता है। ऑटिज्म के क्षेत्र में सरकारी एवं गैर सरकारी संस्थाएं कार्यरत हैं जो भारतीय पुनर्वास परिषद द्वारा पंजीकृत हैं। सोसाइटी फॉर एडवांस स्टडी इन रिहैबिलिटेशन एक ऐसी ही गैर सरकारी संस्था है। कनिष्क 13 साल का एक ऑटिस्टिक बच्चा है जो इसी संस्था से प्रशिक्षण प्राप्त कर रहा है। असंगत क्रियाएं, कार्यकलापों में निरस्ता, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं जैसे बॉडी रॉकिंग और फिंगर रिगलिंग उसमें देखी जा सकती है। उसे मैचिंग और पेस्टिंग, पॉइंटिंग जैसी क्रियाएं सिखाई जाती हैं।
वेरी गुड। ग्लास, वेयर इज द ग्लास? जो खाली बैग है। ग्लास, वेरी गुड। कप को टच करो जल्दी से, कप को। वेयर इज द कप? वेरी गुड। कप में क्या करता है कनिष्क? टी पीता है। चलो ग्लास, वेयर इज द ग्लास? वेरी गुड। चलो बाउल की तरह, बाउल जल्दी से टच करो बाउल को। वेरी गुड। बाउल में क्या करता है कनिष्क?
तथा साथ ही साथ रोजमर्रा की आवश्यकताएं जैसे खाना, पीना, कपड़े पहनना, और व्यायाम संबंधी प्रशिक्षण दिया जाता है। ऑटिस्टिक बच्चों को भिन्न भिन्न प्रकार की कार्यविधियां उनके स्तर के अनुसार सिखाई जाती हैं, जैसे कुछ बच्चों के लिए कलरिंग विद इन वन एरिया, मैचिंग एंड आइडेंटिफिकेशन, फाइन मोटर स्किल्स, आई हैंड कोऑर्डिनेशन, कंसेप्ट ऑफ वेजिटेबल्स, फ्रूट्स, बॉडी पार्ट्स, कलर्स पर जोर दिया जाता है तथा कुछ को प्रश्न पढ़ के उत्तर देने में और रोजमर्रा की आवश्यकताओं को पूरा करने में सक्षम बनाया जाता है। इसके अलावा राइम्स, डांसिंग, सिंगिंग द्वारा लेजर एंड रिक्रिएशनल एक्टिविटीज में भाग लेने के लिए प्रोत्साहित किया जाता है। इन सभी कार्यकलापों एवं प्रशिक्षण का एकमात्र उद्देश्य उन्हें स्वनिर्भर बनाना है ताकि ये डगमगाते पांव सक्षम बन जीवन के एक एक पायदान पर दृढ़ता से आगे बढ़ें और अपनी मंजिल को पा ले। एक तारा टिमटिमाता उसने आकाश को छू लिया, एक लौ जली कहीं उसने अंधकार को मिटा दिया।
वेलकम बैक आफ्टर द ब्रेक। मैं हमारे दर्शकों को याद दिला दूं कि ये हमारे आज के इस सेशन का आखिरी आधा घंटा है, तो आप जल्दी से कॉल कर सकते हैं हमारे टोल फ्री नंबर पे विच इज़ 1800112008। हमारा लैंडलाइन नंबर है 26511613 और हमारा फैक्स नंबर है 26511609। तो जल्दी से कॉल करिए हमारे नंबर्स पे और आप प्रश्न पूछ सकते हैं हमारे एक्सपर्ट से आज के इस टॉपिक से रिलेटेड। So continuing with our discussion, sir, we were.
So after that, we were talking about the flexed hip only. That was a very short above elbow amputations के लिए.
And weight bearing stuff.
And weight bearing. That is the weight bearing. Today's topic is end weight bearing. So there are many processes, but only that we are talking about the end weight bearing processes, where the weight is being borne by the end of the stump, end of the residual part of the body. So after the flexed hip, we have got a completely hip disarticulation. That if you can see the slide, the child lost the leg, maybe because of the accident. Completely leg has been amputated at the hip level, and she was with the crutch only, and we tried to make her mobilize with the help of a prosthesis. So in this case, now she has lost hip joint, she has lost knee joint, and she has lost the ankle as well as. So whole leg has been, everything has been lost. All the three things has to be controlled with the residual part of the body. जो उनका बचा हुआ हिस्सा है बॉडी का, उसके साथ ही उनको she has to learn how to mobilate. So we have got a prosthesis for her. So she was fitted with the prosthesis. You can see in this socket is being like a bucket type socket, which is around the pelvis also. The other side it is come with that strap which holds the whole of the prosthesis with the body itself. So this is the self suspension itself. The socket is a self suspension with the one strap only, and the socket is the base where the fitting the stump, because it should be snugly fitted. ये एकदम से ऐसा फिट होना चाहिए कि अंदर लूज भी नहीं होना चाहिए, बहुत टाइट भी नहीं होना चाहिए. लूज अगर लूज होगा तो स्टंप अंदर ही मूव करता रहेगा, पूरी प्रोसेस को मूव नहीं कर पाएगा, बिकॉज स्टंप ने ही जो है जो रिमेनिंग लेग है, जो आर्टिफिशियल लेग है, उसको भी मूव करने के लिए उसी स्टंप को यूज़ करना है. तो अगर वो अंदर लूज होगा तो सॉकेट के अंदर ही हिलता रह जाएगा, सॉकेट वहीं का वहीं रहेगा, नीचे की प्रोसेस नहीं चल पाएगी. सो द सॉकेट इज स्नगली फिटेड, एकदम बॉडी के साथ फिट होएगा. अगर वो स्टंप को मूव करती है तो उसके साथ साथ लेग को भी मूव करना होएगा, लोअर लेग जो है. सो उसके साथ में हमने हिप जॉइंट, थाई पार्ट, knee joint, shin part, and then the foot and ankle. All these components has been fitted. Again, the selection of the component is as per the requirement or the condition of the individual person. Because ये एक गांव से आई थी, तो इसको इस तरह का प्रोसेसिस देना हमने ठीक समझा जो इसके लिए मेंटेनेंस फ्री हो. अगर मेंटेनेंस की ज़रूरत भी पड़े तो इसको बार बार शहर में भागना ना पड़े. तो इसके अंदर कंपोनेंट्स भी इस तरह के इस्तेमाल किए गए हैं जो उसको कहीं भी रिपेयर करवा सकते हैं करके. पिछले 2 साल से तो कभी आई नहीं रिपेयर के लिए, वेरएस इसकी एज ऐसी है कि ग्रोइंग एज है, इसको आना चाहिए. लेकिन गांव में रहने वाले हैं, किस तरह से मैनेज कर रहे हैं ये तो कुछ कह नहीं सकते हम इसके बारे में, बट किसी न किसी तरीके से तो मैनेज कर रहे हैं. जबकि हमने इसके अंदर प्रोविज़न रखा हुआ है, इसको हम एक्सटेंशन दे सकते हैं. अंदर इसके जो शिन पार्ट है उसको भी लंबा कर सकते हैं, जो थाई पार्ट है उसको भी हम इंक्रीज कर सकते हैं. क्योंकि इसने ग्रो तो करना ही है. सिर्फ एक फुट पार्ट है जो आर्टिफिशियल फुट है, उसको बड़ा नहीं कर सकते, उसको रिप्लेस ही करना पड़ेगा. पैर दूसरा वाला बड़ा हो जाएगा, ये छोटा रह जाएगा. जब बच्ची दोनों शूज़ खरीदने जाएगी तो उसको शूज़ तो बराबर मिलेंगे. तो फुट का साइज़ हमें बदलना ही पड़ता है. फुट तो साल बाद 1.5 साल बाद हमें उसका साइज़ बदलना ही पड़ेगा. बट बाकी का पोर्शन, शिन पोर्शन इंक्रीज कर सकते हैं, थाई पोर्शन को इंक्रीज कर सकते हैं. सॉकेट में ज़्यादा डिफरेंस नहीं है तो कैन बी कंटिन्यूड विद द सॉकेट इटसेल्फ, बिकॉज साइज़ में जो चेंजेस, अगर ज़्यादा मोटापा नहीं आया, बड़ी नहीं हुई, ग्रो कर रही है, हो सकता है मोटी ना हुई हो, तो उस वजह से देन वी कैन हैव दिस सेम सॉकेट कैन बी यूज्ड अगर कुछ अल्ट्रेशन या कुछ अमेंडमेंट की ज़रूरत है तो करी जा सकती है, बट होप सो कि शी विल बी कमिंग विद इन अ शॉर्ट पीरियड। तो इसका जो भी करने वाला होगा, बट शी इज़ वॉकिंग वेरी कंफर्टेबली, इसका आराम से इसके बाकी का पार्ट जो है, एंड इट गिव्स ऑल द प्रोविज़न। सिटिंग का प्रोविज़न है, चेयर पे बैठ सकते हैं, ज़मीन पे नहीं बैठेंगी, चेयर पे बैठ सकती हैं विद द फ्लेक्शन ऑफ द हिप एज वेल एज फ्लेक्शन ऑफ द नी, दोनों फ्लेक्स करके ये चेयर पे आराम से बैठ सकती हैं। एंड दिस इज़ द थिंग विच इज़ वेरी लाइट इन वेट। आप कवर देख रहे हैं, फोम कवर है, इसके अंदर पूरा मेटल का बना हुआ है, जो वेट बेरिंग एरिया है दैट इज़ द मेटल।
That is also known as endoskeletal design. You will get aluminum bars are there inside, so that is lightweight and you can easily elongate, extend the height.
We can extend
decrease
it.
the height.
So we have kept
So
the provision.
external part, that cosmetic looks what you are saying, that is actually a foam. Actually, it's a glove.
Foam
And
can
actually,
go.
this is a complicated prosthesis. It's not that easy to make it because the patient has lost all the joints. The functional point of view, nothing is left. So normally in below knee, the patient can walk very easily because he is having knee muscles. In above knee, at least the patient is having hip muscles. Here you don't have hip muscles, you don't have knee muscles, you don't have ankle. So any part of the body is not there. Only the pelvic girdle is there. The weight is borne by the ischial tuberosity. That is the only part where you are taking weight bearing. And the moment for making the patient walk, actually you have to take the rotation of the pelvic girdle movement. Actually, you have to rotate the
From the
pelvic
hip
and,
only.
and you have to.
From the hip, patient has to
Means-
motivate.
means actually
She
hip
has
is
to
not
motivate.
there. Even hip is also not there. Pelvic rotation, then you have to take a forward move. So that is the problem, and
But
you have
she has
to,
learned how to walk. It.
So
She is
you have to
walking
train
without
a
any
patient
support.
for a longer period.
She walks with without any support, and she's maintaining
And
very
even
nice.
the assembling of this element of this prosthesis
Alignment is
is
very
not
important.
that easy. It's very complicated one.
See, this is the alignment
And
that
see
we
the
keep.
element, it's very difficult. The placement of the hip joint in this is anterior. Normally the hip joint placement is at the level of
At the level of
greater
trochanter.
trochanter, but here you have to take anterior to this.
We have to keep the
And
anterior hip
placement of
joint.
the knee is posterior to the hip knee ankle line, but that is for the stability point of view. So all these precautions we have to take place. We have to stabilize the knee, because to stabilize the knee we don't have hip extensors here. So that is also a problem. So that is in the alignment itself we have to stabilize the knee also. So it's a really is a challenging
Yeah,
job.
one has to
a
even
challenging
prosthetist
job.
has to work
So
hard.
it's not that
along,
easy.
along with the person who is using this prosthesis. So दोनों को अच्छा काम करना पड़ता है. And sometimes see we ask them to go for a therapy also if they want to the therapist to learn how to, if they want to spend the time. But usually we have found that a person who is using it, they develop their technique themselves because they learn very fast. उनका अंदर से समझ में आती है कि what can I do, किस तरह से वेट डालूंगा और किस तरह से आएगा. With the help of a prosthetist उनको बताते हैं कि आप वेट बेरिंग ऐसे करिए, स्टेप आगे लीजिए, छोटा स्टेप लीजिए, बड़ा स्टेप लीजिए. सो अकॉर्डिंगली उसके हिसाब से वो चलना शुरू करते हैं. सो स्टेप तो वही रहता है. सबसे पहले तो बैलेंस ही करवाते हैं, जैसा सर ने पहले मनोहर सर ने बताया कि आपको उसको पहले प्रोस्थेसिस फिट करके उसको पहले उसके ऊपर बैलेंस करना सिखाते हैं. वेट बेरिंग आप
Weight bearing.
खड़े होइए, बिना सहारे के खड़े हो जाइए. एंड उसके बाद हम उसको वेट ट्रांसफ़र करना सिखाते हैं. एक बारी लेफ्ट साइड पे, एक बारी राइट साइड. नॉर्मल लेग पे वेट ट्रांसफ़र करने में उनको बिल्कुल परेशानी नहीं होती बिकॉज इट्स नॉर्मल. ऑन द आर्टिफिशियल साइड ओनली what we want that they should be able to bear a weight on the artificial leg for the moment जितनी देर में एक स्टेप उठ के पैर आगे जाता है.
Absolutely.
समझ रहे हैं? उतनी देर के लिए उसके ऊपर पूरा बॉडी वेट आना चाहिए. सो वो हम उनको बैलेंस करना सिखाते हैं कि आप सबसे पहले खड़े खड़े स्टेप मत लीजिएगा. आप एक जगह खड़े होकर आर्टिफिशियल लेग के ऊपर पूरा बॉडी वेट डालिए और दूसरे पैर को उठाइए और छोड़ दीजिएगा, उठाइए और फिर रखिए. सो दैट कि इसके बाद आप फुट को आगे वहीं खड़े खड़े इस लेग को वहीं खड़ा रहने दीजिए, आर्टिफिशियल लेग को, एंड द नॉर्मल लेग को उठा के आगे और पीछे करते रहिए ताकि आपकी प्रैक्टिस बने कि आप जब चलेंगे तो दिस इज द वे दैट यू आर गोइंग टू वॉक. इसके ऊपर बॉडी वेट पूरा आएगा, देन ये पैर उठ के आगे जाएगा. इसके ऊपर वेट डालने में, नॉर्मल फुट के ऊपर तो आपको वेट डालने में बिल्कुल भी प्रॉब्लम नहीं है. तो यू आर एबल टू वॉक विद दिस. ओनली द थिंग यू हैव टू लर्न हाउ टू पुट अ वेट ऑन आर्टिफिशियल लेग, और उसके ऊपर बैलेंस कैसे करना है उतनी देर के लिए जितनी देर में एक स्टेप उठ के आगे जाता है. इतनी देर के लिए कम से कम मिनिमम इतना चाहिए आपको, सो दैट कि आप कंफर्टेबली जितना अच्छे से उसको कर लेंगे आपकी वॉकिंग उतनी अच्छी बनेगी. चलने में बहुत आसानी रहती है उसके साथ में. सो दिस इज टोटली बेस्ड ऑन अलाइनमेंट क्योंकि जब वो उसके ऊपर बॉडी के ऊपर वेट डालें ऐसा ना हो कि बकल कर जाए. इट शुड बी स्टेबल. पूरा वेट उसके ऊपर लेने के लिए पेशेंट शुड बी इन्हें कैपेसिटी होनी चाहिए उसके अंदर कि उसके ऊपर पूरा वेट डाले बिना किसी डर के उसके ऊपर खड़ा रह करके. सो दिस इज द अलाइनमेंट.
This is the level of amputation where you need an external support like a stick, or the patient may need a crutch. So that is essential in this case. You have to advise the patient to take a stick compulsory. So otherwise there are chances of falling down if the patient is not confident. So that
और एक
must
स्टिक
actually
के साथ में ये भी रहता है ना, मैंने बताया जैसे आपको, दिस इज अ इंडिकेशन दैट फॉर द अदर्स आल्सो कि इनकी कुछ पैर में कुछ प्रॉब्लम, बिकॉज ट्राउजर के अंदर सब कवर रहेगा, कुछ दिखाई नहीं देगा कि इन्होंने आर्टिफिशियल लेग पहनी हुई.
For example, I will tell you, one normal person holding a stick, getting into a bus, DTC bus, with a stick he is walking there, and any person who is saying him he is holding a stick, maybe some problem is there, so they will give
Offer
a
the
stick.
seat.
So he is taking advantage of the stick actually there.
And there's a misuse of all these things nowadays. You can see the beggars at the red light.
Yes.
They
Yeah,
just hold
absolutely.
the crutches. They
That is
just hold the
absolutely.
crutches. They don't have any problem, but holding the crutches, showing that they are disabled, just
And
for
then try
begging
to beg money.
purpose, they are giving. This is just to show them that they are the.
Some misuse of appliances is also there.
So in this case, we were just talking about that the alignment should be in a proper way, so that there are another type of the hip disarticulation prostheses are there, which are Canadian type, which are being used, which were used earlier itself. बहुत पहले इस्तेमाल हुआ करती थी ये, जो अभी totally conventional type है. These are the conventional type of the prosthesis जो पहले बना करती थी, जिसके अंदर everything was वुड और स्टील के साथ में बना के इसको यूज किया जाता था, और इसको प्रोसेसेस, बट फंक्शनली दे वर फाइन.
The components are made out of wooden.
कंपोनेंट्स लकड़ी के थे, लेकिन the function was quite good.
And the
satisfactory.
same function the patient used to get. Only thing, the weight of the prosthesis.
Weight of the
little
prosthesis
more.
was little more, थोड़ा ज़्यादा हो जाता था उसके लिए, बट वर्क भी प्रोस्थेटिस्ट को भी ज़्यादा काम करना पड़ता था इसके ऊपर, बिकॉज ईच कंपोनेंट के लिए उनको काफ़ी टाइम इसके ऊपर स्पेंड करना पड़ता है बनाने के लिए, और एवरीथिंग हैज़ टू बी डन. बट ओनली द थिंग, the main target is that we need a function out of the prosthesis which can help the disabled person, the person who has lost the leg. उसके लिए पूरा functions उसको नॉर्मल मिल जाए करके. तो इसलिए ये सब प्रोस्थेसिस जो हम लोग बनाते हैं, जो भी हम प्रोस्थेटिस्ट इसके ऊपर काम करते हैं, बेसिकली दैट वी वांट द पर्सन शुड बी मोबिलिटी होना चाहिए, उसको एम्बुलेशन उसका इजी हो जाए, वॉकिंग अच्छी हो जाए, एंड शुड बी एबल टू परफॉर्म हिज ओन लाइफ एट हिज ओन और हर ओन. जैसा जैसा उनका होगा उसके हिसाब से दे कैन मैनेज विद द प्रोस्थेसिस इटसेल्फ. बट दिस प्रोस्थेसिस इज मोस्ट कॉम्प्लिकेटेड. आफ्टर दैट वी गॉट सम components which are modular components. We can see in this slide, you can see these are the components which are, one is covered with the foam cover, and inside that you can see the tubing is there, aluminum tube with the joints itself. And there's another red color, you can see the indigenous joint that we have made in our own country, local joints with our local material to just reduce the cost. वेट में इतना फ़र्क नहीं आएगा क्योंकि उसका और इसका वेट में ज़्यादा फ़र्क नहीं आया था, बराबर ही वेट आ रहा था. द फैब्रिकेशन सिस्टम इज सेम, द वेट बेरिंग एरिया इज द सेम, कीपिंग द एंगल एंड एवरीथिंग, दैट अलाइनमेंट इज द सेम. ओनली द थिंग, वी रिड्यूस द कॉस्ट बाय यूजिंग अ लोकल मटेरियल, यूजिंग द लोकल माइल्ड स्टील और द ट्यूबिंग और एल्यूमिनियम ट्यूब इटसेल्फ. With this, we could get very good results of the prosthesis, which can be provided to the persons who are disabled. And but nowadays, these components have become very familiar with all the prosthetics, और सब सेंटरों में मिलने लगे हैं, अच्छे अवेलेबल हैं सब जगह joints में.
You will get sophisticated component parts.
कॉस्ट भी अभी इतना ज़्यादा नहीं रह गया, कम हो गया है, तो काफ़ी इसमें. Only the thing, the skill of fitting, उसको ठीक से अलाइन करना, उसको प्रॉपरली पोजीशन करना, कहाँ पे रखना है और कैसे रखना है, राइट फ्रॉम द बिगनिंग. सबसे पहले कास्टिंग, जब उसका कास्ट लेते हैं, नेगेटिव इम्प्रेशन लेते हैं पेशेंट का, वहाँ से लेके फाइनल फिटिंग तक, असेंबली करने तक, एवरीथिंग हैज़ टू बी टेकन केयर बाय द प्रोस्थेटिस्ट, सो दैट patient should be quite comfortable with that, and weight bearing should be comfortable. First thing is the balancing, and then movement of the joints, then how to move the joints with the help of elastic. You can see the slides. We can put some elastics also. We have fitted a elastic in the anterior side, so that which helps the extension of the prosthesis.
So these elastics actually replace the muscles actually.
Ligaments
muscle
जो
power
हमारे
actually.
काम करते हैं उनके
The
वजह
muscle,
से
the anterior elastic is working as quadriceps muscles, the knee muscles, to stabilize the knee. The posterior muscle, the elastic will work as hip extensors. So these are compensating the lost part of the body by means of functional action actually.
So these are the components, modular components, compared with our own indigenous design also. There are so many people, there are so many centers, those who are working on these artificial limbs, and they are also producing at their own, their style, their components as per the requirement of their patients, their users, and they are quite successfully using this prosthesis. And if we go for the detail, see, these are the different type of the hip joints for the prosthetic fitting of the hip disarticulation. And hip disarticulation means one has to rest on it. You can see the seat on each and every different type of the joints. There is a seat on it, and the patient has to sit on it. That is the seat is being provided with that. So this is the way that patient sits on it, and
That is
he feels that
actually
he's
the
sitting.
weight bearing base
That is
actually,
the
the
weight
hand
bearing
weight bearing base. So that is actually.
So these are the different type of the hip disarticulation joints.
The patient will be comfortable to walk in with this thing.
Yes, this prosthesis, definitely they are comfortable. You have seen a little girl only. She's walking without any support.
Comfortable, but they
Because
need
she's-
more effort actually to walk.
She's
It's
quite
not
young.
like other prosthesis. This
उसको
is a
लर्न करने में
complicated
ज़्यादा
process.
दिक्कत नहीं हुई. जो बच्ची को आपने देखा उसको लर्न करने में ज़्यादा परेशानी नहीं हुई, बिकॉज छोटी एज में है. अभी लर्निंग एज है उसकी, ऐसी एज के ऊपर है जहाँ पे वो बड़ी इजीली ग्रैब कर सकती है उसको टेक्निक को. तो उसने बड़े अच्छे से डेवलप कर लिया, एंड शी इज़ वॉकिंग विदाउट एनी सपोर्ट. बट फिर भी उसको थोड़ा सा एक स्टिक के लिए हम कहते हैं कि साथ में रखें. उसको स्टिक रखने के साथ साथ उसका थोड़ा सेफ रहेंगे, किसी दूसरे लोगों से धक्का ना लगे करके, इसके लिए. बिकॉज इसके अंदर पूरे जॉइंट्स लॉस्ट हैं हमारे पास. हिप जॉइंट नहीं है, नी जॉइंट नहीं है, एंकल जॉइंट नहीं है. तीनों जॉइंट नहीं होने की वजह से इनका नी जॉइंट, इनके जॉइंट्स का कंट्रोल भी नहीं है. कंट्रोल इज ओनली विद द अलाइनमेंट. जरा सा भी पुश मिलने से अलाइनमेंट खराब हो जाएगा तो गिर जाएंगे, क्योंकि उसके ऊपर कोई मस्कुलर या कोई इस तरह से लिगामेंट्स का कंट्रोल नहीं है.
Patient using the trick movements, pelvic rotation movement, nothing else.
तो उनकी जो बॉडी की रिमेनिंग मूवमेंट है उसी को ही वो ट्रांसफर करते हैं, यूज़ करते हैं मोबिलिजेशन के लिए, उनके चलने के लिए, एंड दे इट मेक्स देम क्वाइट वॉक. कुछ कॉन्जेनिटल डेफिशिएंसीज भी होती हैं बाय बर्थ. जन्म से भी कई दफ़ा ज़्यादातर होता है. बहुत सारे ऐसे केसेस आते हैं जिनके आप इसमें देख सकते हैं कि एक बच्चे के पैर जो है ना डेवलप ही नहीं हो पाया करके, बाय बर्थ ही डेवलप नहीं हुआ. आगे के फिंगर्स भी देखिए, अंगूठा भी नहीं है. आगे की जो टार्सल के बोन्स के बाद में जो मेटाटार्सल बोन्स हैं वो भी नहीं है इसके अंदर. तो ये सारी की सारी जो फुट है बहुत छोटा सा रह गया है, एक डिस्टल एंड रह गया. इसको क्या करेंगे, एंड वेट बेरिंग प्रोसेस में ही आएगा, बिकॉज इट्स लाइक अ पार्शियल फुट एम्पुटेशन. तो उस तरह का ही ये केस है जिसके अंदर समझिए एम्पुटेशन नहीं है, बट इट्स बाय बर्थ इट्स ए फुट इज नॉट कम्प्लीटली डेवलप्ड, इट्स अ हाफली डेवलप हुआ फुट है. तो इसके अंदर क्या होता है कि जस्ट 4 फुट फिलर देंगे इसके अंदर, 4 फुट फिलर इसके अंदर डालेंगे, तो ताकि उसके अंदर जो वेट बेरिंग एरिया है इज क्वाइट कंफर्टेबल, बिकॉज ही हैज गॉट अच्छा वेट बेरिंग एरिया इसके अंदर. जस्ट सामने का 4 फुट नहीं है. 4 फुट के भी यूज़ होते हैं. हमारा ऐसा नहीं है कि 4 फुट यूजलेस है, जो अगर नहीं है तो काम चल जाता है. बट ओनली द थिंग, देयर आर सम मूवमेंट्स जो हमारी 4 फुट की मूवमेंट्स होती हैं, जो हमें पुश ऑफ मिलता है चलते वक्त. जब हम पंजे पे मुड़ते हैं, एक स्टेप पे उठाते हैं, तो हमारा जो 4 फुट है हमें पुश देता है ताकि हमारा स्टेप आगे जाता है करके. सो वो टेक्निक इनको डेवलप करनी पड़ती है, ना कि फुट से मिलती है. 4 फुट से हमें नहीं मिलती है पुश ऑफ, क्योंकि वो तो आर्टिफिशियली रबर भरा हुआ है उसके अंदर. इट्स ए फिलर ओनली. बट ओनली द थिंग, उसको मूवमेंट अपनी लेग से उठा के आगे ले जानी पड़ती है विदाउट द पुश फ्रॉम द ग्राउंड. जो हमें ग्राउंड से पुश मिलता है वो नहीं मिलता उनको, फुट को फॉरवर्ड मूव कर लेते हैं. Later on we can see that if we need a push off, then we can put a steel strip or some spring action under the forefoot itself, so that we can get some push off from that if the child wants to run.
Means
also
any part missing part of the body by birth, so we'll try to compensate it by means of artificial one, and we'll try to make the patient ambulatory, and we'll also try to give a cosmetic appearance in that, so that he is not actually congenital deficiency prosthesis.
there are some other congenital
Normally
deficiencies
all these
also.
prostheses are end weight bearing only commonly.
I'll show you another slide. See, this is another case. This is also congenital. The person has lost, not lost, it's not developed actually, the shin part. Straight away
in this the shin part is there.
No, shin is not there. Only the
foot is there.
foot is
Upper portion is not there.
at the
hip portion means that portion is not
from
there.
the hip straight away. See, foot is at the knee level. Below the that
the
other
foot
leg
is hanging at knee level, and that's why we have to elongate it the lower level. Means we have to provide a shin block instead of providing a hip and thigh portion actually.
So the person is standing on the foot piece itself. The foot is weight bearing area. The end weight bearing is there. Foot is capable to bear the weight. Only the thing that we have to compensate the distance between the foot and the ground. So we have to make it level with the other leg, so that both the legs are in the same height. Then only one can walk. One cannot walk with the difference of the legs. It's very difficult. So with this, the person who has we have provided the shin part, and this artificial leg has been made in such a way.
In other words, we are compensating the shortening actually.
And this we call it extension prosthesis.
So that is extension prosthesis.
This is the extension prosthesis. This is the whole leg, maybe half, maybe any part, maybe
Any
6
level,
inches,
any
maybe
level.
8 inches. Any distance, leg length discrepancy is there, that has to be provided with the extension prosthesis, which is end weight bearing prosthesis. The extension prosthesis is always the end weight bearing prosthesis.
Means the weight is borne by the foot only.
So these are the thing. See, we have got the different type of the end weight bearing prosthesis, where we can have the weight at the distal end of the stump or distal end of the body part, where the weight is being borne, and the rest of the prosthesis is being mobilized with the residual part of the prosthesis. So these are the things that we have seen today. The prosthesis is that different type of the prosthesis of the for the different level of amputations is there.
Okay, so as you've already summarized with whatever we discussed in the 2 hours last, so I think सबसे पहले हमने बात की थी advantages की about the end weight bearing prosthesis, जैसे कि आपने बताया, क्योंकि जो weight bearing जो portion है, it's more wide here. So this is one of the advantage. Then the another advantage was that there was no or maybe the minimum suspension, as you had mentioned. Then we discussed descriptively about the different amputations, चाहे वो partial foot amputation हो, through ankle amputation हो, या फिर knee amputations की हमने बात की थी, very short below and above both the knee amputations we talked about, and end में हमने hip disarticulation के बारे में भी बात किया था. Then we talked about the different factors that should be kept in mind while providing any artificial limb to any user. For example, age की हमने बात की थी, then environmental factors की हमने बात की थी, and of course personal body weight की बात की, और end में हमने बात की different congenital deficiencies की, जिसकी वजह से किसी भी user को ज़रूरत पड़ती है किसी भी prosthesis की. So thank you so much sirs for coming here, और आपने prosthesis के बारे में, end weight bearing prosthesis के बारे में हमें आज जानकारी दी. आप देखते रहिए RCI का नवशिखर चैनल. हम अगली बार फिर लौटेंगे नए डिस्कशन और नए एक्सपर्ट्स के साथ. धन्यवाद.
Thank you.